everyone, I'm Ajeburo Ifeanyi Precious, an expert in environmental biology and community health. Now, COVID-19 has some symptoms, and cough is one of the symptoms of COVID-19, but that doesn't necessarily mean that all cough are caused by coronavirus. No. Some might be as a result of an allergy, some might be as a result of lung cancer, and some might be as a result of tuberculosis. Yes. So today I'll be talking on tuberculosis. Tuberculosis is a disease that is caused by the Mycobacterium tuberculosis, and it affects the lungs just like coronavirus. So that's why you can have cough when you have tuberculosis. So that's the more reason why when you have cough, to not just conclude that you have coronavirus, make sure you do go for a test and be sure of whatever disease you're suffering from. So I'm mentioning some of the symptoms of tuberculosis so that you can always go for checkup whenever you notice any of the symptoms. When you have a cough that's more than a week, or sometimes when you cough you feel pains in the chest, when you're breathing you feel pains in the chest. Sometimes you might cough and you cough out blood. If you're having loss of weight, loss in appetite, night sweats, fever, and the likes, then you should go for a checkup and check if you have. The earlier you diagnose the fact that you have tuberculosis, the better. And now, to the people who are already diagnosed of tuberculosis, please make sure your treatment is not interrupted, because an interrupt in the treatment of tuberculosis can render that treatment negative. That is, you would not recover. Now, tuberculosis is not like some other disease or some other infections per se that you treat 1 week or 2 weeks and then you're fine. The treatment of tuberculosis can go as long as 18 months, and within these 18 months, drug usage should not be skipped or interrupted, because a little chance can give the bacteria room to form resistance, which our Mycobacterium tuberculosis knows how to do very well. Now, if you're treating tuberculosis, you have to be very consistent, because one of the major problems of tuberculosis is not the fact that there is no cure. There is a cure for tuberculosis, but the major problem is the resistant factor. Once your bacteria forms a resistance to the particular drugs you're taking, then that drug no longer has effects on that bacteria. So that's the more reason why you shouldn't skip your medications, and you should make sure that your medications are not interrupted. And you should try as much as possible not to add another disease to the one you have already. Let's say, for instance, you have tuberculosis and now you get infected with COVID-19. Do you realize that the medication for tuberculosis has to be stopped for COVID-19 to be treated? And once tuberculosis medication is stopped, a bacteria forms a resistance to that drug, and you might eventually not get treated from tuberculosis. Now, we're in an era where we have a pandemic, coronavirus, and it seems like we're no longer looking at other diseases, and we're only taking precautionary measures against coronavirus. This is just to, bring us back that there are more deadly diseases that can take our lives more than the current pandemic we're in. Yes, it is necessary to follow every precautionary measures for COVID-19, but it's also necessary not to put yourself at the risk of getting a more deadly virus or a more deadly bacteria. So whatever be it, always stay safe and always try to protect yourself from every kind of infection. Thank you.